As part of our 2025 clinical outcomes report, which we share with our clients and our clinical teams, of course, to see how patients are doing, we wanted to share some exciting results that we're seeing in patients that are being monitored who have diabetes. Now, the data that I'm going to show you is observational in nature. We'll be putting this together with some other data for hopefully some peer-reviewed publications. So it's very preliminary and it's observational, but we are excited to see that these patients that started with a baseline reading of diabetes, that means that their fasting blood glucose over their first week of data transmissions happened to be over 125 milligrams per deciliter, that we got to see some pretty impressive improvements here. Over 1,000 patients that were on the program for at least 90 days that had, in their first week of readings, their first 2 readings averaging in diabetic range. This happened to be a fairly poorly controlled group of Medicare patients with a fasting blood glucose of over 170 milligrams per deciliter at baseline. They improved by 28 milligrams per deciliter down to around 140 while on the program when we compare that first week of readings to their most recent week of readings. It's important to point out that these patients, when they started on the program, they didn't initiate the program with any new clinical changes. It wasn't like they started the program with a brand new medication. These were patients that had been with their provider for about a year at least before starting the program, and they were undergoing conventional treatment. So the addition of the RPM program was just something new. With the monitoring, of course, it's set up for proactive care. So if the clinical care navigators that are monitoring the patient see either spikes or drops in blood glucose that are concerning, whether it be trends or an acute change, they will reach out to the patient. In addition to that, they'll contact the patient monthly to see if they need anything, and they go over the care plan, talk to them about evidence-based lifestyle strategies, medication compliance, things like that. When we isolate a cohort of patients that have been on the program for 12 months, so basically 30 bins since their first 2 measurements, where we got their average, their baseline, and we looked at it over the course of 12 months on the program. We see that the patients improved first 3 or 4 months pretty dramatically, and then they maintained that improvement without really quite plateauing all the way across the year. Now, in a disease like diabetes, where typically it worsens with age, it's also important to see over the whole of the program duration how patients do. So we took our patients and we grouped them into quartiles based on the length of their RPM program. Quartile 1, 90 days to even over a year, and quartile 4, patients that have been on the program here for over 800 days. You can see consistent improvements in each quartile, and in fact, in terms of magnitude, quartile 4 actually had the highest amount of fasting blood glucose improvement, which of course is impressive. And looking more closely at those cohorts, we can also see what percent of these patients were able to reach control range. So an average for the 30-day bin of measurements that was below, was 125 milligrams per deciliter or below. So no longer in diabetic range. And you can see quartile 1, around 40% of the patients reached goal. And in quartile 4, the patients that have been on the program the longest, 56% got that fasting blood glucose number down under 125 for their average for the month. And this is observational research. This is something that we share internally, and here we like to share it externally because we find this to be an effective method of improving care for diabetic patients, making it more proactive and more accessible, and we're excited to share more of it as